after your COVID-19 vaccine AstraZeneca. Today you have received COVID-19 vaccine AstraZeneca. This vaccine can prevent people from becoming ill from COVID-19. COVID-19 vaccine AstraZeneca does not contain any live SARS-CoV-2 virus, the virus that causes COVID-19, and it cannot give you COVID-19. It contains the genetic code for an important part of the SARS-CoV-2 virus, called the spike protein, that is carried into your cells by a harmless common cold carrier virus, an adenovirus. Your body then makes the spike protein and uses it to learn to recognize and fight against the SARS-CoV-2 virus. The adenovirus has been modified so that it cannot replicate once it is inside cells. This means it cannot spread to other cells and causes infection. What to expect after vaccine? As with any vaccine, you may have some side effects after receiving a COVID-19 vaccine. Common side effects after COVID-19 vaccine AstraZeneca include pain, swelling, tenderness, redness or itching at the injection site, tiredness, headache, muscle pain, nausea, fever and chills, feeling unwell, and joint pain. Less common side effects after COVID-19 vaccine AstraZeneca include enlarged lymph nodes, pain in limb, dizziness, decreased appetite, and stomach pain. These side effects are usually mild. They occur in around 2/3 of people who are vaccinated. Start within a day after the vaccination and go away within 1 or 2 days. Some people will have more significant flu-like symptoms from this vaccination compared to other vaccines, and may require time away from normal activities. These symptoms are more common after the first dose compared with the second dose. If you have pain at the injection site, fever, headaches, or body aches in the first 1 to 2 days after vaccination, you can take paracetamol. This helps to reduce some of the above symptoms. You do not need to take paracetamol or ibuprofen before vaccination. If there is swelling at the injection site, you can use a cold compress. Rare side effects that have been reported after COVID-19 vaccine AstraZeneca are severe allergic reaction, anaphylaxis. Anaphylaxis after COVID-19 vaccine AstraZeneca is very rare. The rate in Australia appears similar to any other vaccine. A condition called thrombosis with thrombocytopenia syndrome, TTS, which involves blood clotting, thrombosis, and low platelet levels, thrombocytopenia. Information from Australia and overseas shows that TTS is a rare condition. The blood clots can occur at different parts of the body, including the brain. This is called cerebral venous sinus thrombosis. And the abdomen, this is called idiopathic splenic vein thrombosis. The low level of blood platelets can cause bleeding. The symptoms of this condition occur around 4 to 28 days after vaccination. People with this condition are very unwell and need to go to hospital. This condition can lead to a long-term disability and even death. More information on TTS can be found in the patient information sheet on AstraZeneca COVID-19 vaccine and TTS. You should seek medical attention after vaccination if you think you are having an allergic reaction. Call 000 if you experience severe symptoms such as difficulty breathing wheezing, a fast heartbeat, or collapsing. If you have an unexpected side effect of the vaccine that has not gone away after a few days. If you have any of the following symptoms, particularly around 4 to 28 days after vaccination: severe persistent headaches that are different to your usual headaches and do not settle with paracetamol or other painkillers, blurred vision, weakness of face or limbs, confusion or seizure, shortness of breath, chest pain, persistent abdominal pain, leg swelling, pinprick rash or bruising not at the injection site that cannot be explained. Be sure to tell your doctor that you have recently received the vaccine. For symptoms which are not urgent, you can seek your regular healthcare provider, usually your GP. Vaccine safety monitoring and reporting side effects. You can report suspected side effects to your vaccination provider or other healthcare professional. They will then make a formal report on your behalf to your state or territory health department or directly to the Therapeutic Goods Administration (TGA). If you would prefer to report yourself, please visit the TGA website and follow the directions on the page www.tga.gov.au/reporting suspected side effects associated COVID-19 vaccine. COVID-19 testing after vaccination. Some side effects from COVID-19 vaccination might be similar to symptoms of COVID-19, for example, fever. However, COVID-19 vaccine AstraZeneca does not contain any live SARS-CoV-2 virus and cannot cause COVID-19. You may not need to get a COVID-19 test or isolate. If you develop general symptoms like fever, headache, or tiredness in the first 2 days after vaccination, and if you are sure that you don't have any respiratory symptoms, for example, runny nose, cough, sore throat, loss of smell, or loss of taste, however, you should check the current guidelines in your state territory for the most up-to-date information. This advice might be changed in the event of COVID-19 outbreak in your local area. You may still need to get a COVID-19 test if you meet other criteria. For example, if you are close contact of a non-COVID-19 case. If in doubt, seek medical assessment. Remember your second appointment. It is important that you receive 2 doses of COVID-19 vaccine AstraZeneca, about 12 weeks apart. The second dose will provide you with better protection against COVID-19. How the information you provide at your appointment is used. For information on how your personal details are collected, stored, and used, visit www.health.gov.au/using our websites/privacy/privacy notice for COVID-19 vaccinations.